I'm really excited for kind of our closing keynote, and it is something that has been touched on throughout the day and all the way through, right? The seemingly overwhelming nature of behavioral health and the now, new pandemic, right? The existing pandemic that's been on us already for years and years. It's not lost on the governor in the state of Colorado, and he has made some bold steps and put some bold leadership in place and some new structures, some real innovation to kind of push the state forward, but also to push the edges on some conventional thinking. And so I'm super excited about our afternoon keynote, and with that, I will get out of the way and welcome Dr. Morgan Medlock to the stage.
Thank you so much, and good afternoon, everyone. It is fantastic to be here with you. Again, my name is Morgan Medlock. I'm a crisis psychiatrist and very honored to be serving as the first commissioner of the Behavioral Health Administration for the state of Colorado. I hope you will permit me, just before I launch into our topic today, to, we can cue the slides, that's fine, thanks. Just before we jump in, I want to do a bit of introduction. When we were working in Washington, D.C., and I grew up in Texas but moved here from Washington, D.C., and as we were engaging in really critical work there, our task was to try to determine how do we prove engagement of minority communities who were primarily living in disadvantaged wards of Washington, D.C., how do we engage them in life-saving opioid use disorder treatment? And my job was to essentially walk the district, meet with people, build community capacity, build community advisory boards, meet with the nonprofit sector, meet with faith-based leaders, and think about how do we solve this issue that most people who need life-saving care don't access it, and those who are racial minorities, furthermore, don't trust it. And as we begin to talk through strategies for reducing stigma, building bridges, communicating about health equity, breaking down barriers to improve access to whole person care, I was struck by something that one community advisory board member said. She said, the problem with you and government, she said, is you don't think in government about generational impact. She said to me, you don't really have a way of thinking about strategies that will work not just for this generation, but 20 years from now, 3 generations from now. She challenged me. She said, I'm asking you as a government official to think differently about how we work with community, how we co-create solutions, and how we really think about not just downstream impacts, but upstream solutions in terms of policy levers that we can push in order to improve health equity. That stuck with me, and I learned a lot through that journey serving in Washington, D.C., and it dovetailed so nicely into the work that had already been done here in Colorado with the Behavioral Health Task Force that had been established in 2019 by Governor Polis. Some of you served on that task force. You know the arduous journey that was. But I truly believe that this is a moment where we are going to show that government is built for generational impact. I believe we are going to do something in this state that has never been done. And so I want to invite you to join me in this story. I'm going to try to tell it in 20 minutes. It's a story about how the Behavioral Health Administration intends to leverage networked government in order to make a difference, not just now, but for future generations. Join me. So the story actually begins decades, right, prior to now. I got this job really being able to stand on the shoulders of leaders in this state who have pushed for reform, who have pushed for the elevation of behavioral health, whole person health, who have pushed for the end of trifurcation, right? It's irrational that we create doors for mental health, another door for substance use, another door for physical health. All of that is irrational. And there have been leaders in our state who for decades have been pushing for greater coordination of care, greater collaboration, and finally we have it. This is our moment. Governor Polis established the task force. People of Colorado, those who had been harmed by traditional behavioral health approaches, policy leaders, advocates, philanthropists, everyone got in a room, wrestled together, thought about policy issues. We looked at what other states had done. Did they consolidate all of their programs in one agency? We learned that we had 120 programs in Colorado, administered by over 13 cabinet agencies. And so how were we going to center whole person health? And we decided on a new model. We said that we're going to be a state, unlike any other state, that doesn't attempt to consolidate, but attempts to bring together government through a networked approach. We decided that no matter where a person seeks care or how they pay for care, that they should have one agency that is driving coordination and collaboration across all of state government. This is a cross-sector, cross-agency vision. It is truly groundbreaking. And as you know, we often center on our purpose statement, that fundamentally, we believe that every person in Colorado deserves to experience whole person health. And so for us, that means that we must address social determinants of health. And we embrace the CDC definition of social determinants, that it doesn't just mean addressing social needs and risk factors, such as housing and security. Those are important to address. We also need to push upstream, as I learned in Washington, D.C., to address social inequity and the drivers and creators of social risk factors. Because we believe every person deserves to experience whole person health, we envision a world in which services are really three things. They have to be accessible, they have to be meaningful to the diverse communities that live in our state, and they have to be trusted. My goodness. And the way we measure trust is when a person leaves an office where they've received care in our state, would they recommend that care to someone they care about? And so our mission, our story, is one of leaning into the power of co-creation. Fundamentally, we believe that we can co-create a system that has literally never existed. We believe we can co-create a people-first behavioral health system that truly meets the needs of all people in Colorado. Many of you have heard me talk about our values. And I talk about them at every meeting because it's the how that's so important. It's the values that are so critical. And so we start with truth. As we engaged with the task force and with Coloradans across our state, we asked them, what are the key words that represent what you need in this new system? And they said, first, we need an agency that speaks truth, an agency that centers accountability, transparency, and accuracy. They also asked us to lean into equity, that equity is not just one agency's job, there should be an interagency approach to health equity. And again, for us, that means naming root causes of injustice and also allocating the right funding and resources to support the desired outcomes. They asked us to uplift community-informed practice. They expect us to be experts in thinking about national strategy, aligning with federal mental health dollars, and they also want to be valued as local experts in their own experience. And fundamentally, the Behavioral Health Administration believes that our communities can choose the right solutions for them when there is equity of opportunity. They asked us to lift up collaboration. Again, working in partnership, cross-sector, cross-agency to realize this new holistic behavioral health vision. And finally, generational impact. We think we're built for that. Because as long as we lean into co-creation, we believe that we can engage in meaningful and thoughtful action with you and with the people of Colorado to truly create a new legacy 3 generations from now. And so I want to talk a little bit about how the story begins. The BHA model. Again, we chose not to consolidate every program into one agency. Instead, the Behavioral Health Administration is a convener. We are primarily talkers. We get people in a room, we process, we look at national models, we process how programs are delivered. We bring people together. And the model is really, first of all, leveraged on having a cabinet member who is leading this agency. So that is critical. That person who happens to be me serving first in this role, but that person has to be on the cabinet. A person who can speak as a peer to cabinet colleagues and who can elevate this new vision. The second leg of this governance structure is an advisory council. The unique part about this is, again, thinking about co-creation. This advisory council is primarily driven by individuals who have lived experience in the behavioral health system. So I'm very proud to report today that this council is already working. We have 40% representation of Black, Indigenous, people of color on this council. We have 80% representation of individuals who have supported a family member or themselves needed help. And we're very proud of the diversity of this council. We have 50% members representing rural Colorado. We're very proud of that. We also have both tribes of Colorado represented on this council. So a diverse council, that's part of the co-creation model. And then as you look at the bottom of the slide, it shows how we collaborate with all of the other cabinet agencies. How do we bring all of this together? Well, functionally, it comes together through a process called a formal agreement. Quite literally, the Behavioral Health Administration will build its network, if you will, through formal agreements with every single state agency that touches a person. Isn't that powerful? And so the idea of a formal agreement is as it talks about how we work with, for instance, the Department of Corrections. How do we improve criminal justice deflection? How do we work with the judicial branch in order to ensure there's court-based diversion, deflection, support of individuals with behavioral health needs? How do we work with the brand new Department of Early Childhood? They're rolling out universal pre-K throughout the state. How do we ensure that kids 0 to 5 have appropriate behavioral health supports? That's generational impact. We believe that we can not only respond to adverse childhood events, we can prevent them. This is the new model. And so the formal agreement shows us how do we connect, how do we problem solve, how do we engage in policy development, strategic planning, accountability, and data sharing. This is just one way that we continue to build the story. Every month, we come together as cabinet members in a meeting that I convene to talk about whole person health. How do we create a single point of entry to our entire system? How do we build our formal agreement process? We have 17 communication leaders across all state agencies that meet to talk about behavioral health. How do we respond to the community? How do we address investigations? How do we complete appropriate audits? They're working even now to build that process of truth and accountability. We've had over 19 convenings with healthcare policy and finance, and I know that you heard from Director Ben Steffer earlier today, but this is really critical as we're rolling out a new mobile crisis benefit with healthcare policy and finance. As we think about how this story evolves over the next year, we launched July 1, 2022, so we are 4 months old. We have established our Behavioral Health Advisory Council. We've also established the brand new Whole Person Health Interagency Council. Many of you have heard about the new intermediary that will be launched in the state starting July 1, 2024. They're called BASOs, Behavioral Health Administrative Service Organizations. Right now, again, we have a bifurcated system where there's a mental health intermediary, a substance use intermediary, and so that bifurcation will be eliminated through this process. We launched our workforce strategy. For those of you who are following us on the internet, if you go to bha.colorado.gov, you can see there that our workforce strategic plan was released on September 1. And this plan is seeking to bring a new model to Colorado that has been piloted in Alaska called the Behavioral Health Aid Model. It's essentially built on public health practice that has been, based on evidence for decades, that when we use a community health worker model in communities and show that there is community capacity to respond to mental health needs, that can be incredibly powerful. So it's built on the community health worker literature and model. We're also investing in a very new way in peer specialists and empowering them to seek designation from the Behavioral Health Administration so that they can be reimbursed through Medicaid. We will also be the first state to have a cross-payer access to care methodology. And today, I'm not going to go into that, but it's a very interesting methodology. I did introduce it at a recent Providers Association meeting, and we're continuing to stakeholder that to ensure that truly it is cross-payer, cross-sector. And finally, our biggest approach and story for this year is we're beginning to address the rules and standards of the entire continuum and thinking about how do we support Coloradans literally from birth until maturity. How do we think about a complete continuum of care from prevention to recovery? But ultimately, network government doesn't work if the story does not impact people. And so as we think about our role in the system, it's not just about bringing together networked government. It's about behavioral health that's for the people and by the people. The people of this state called for this vision. They asked for a behavioral health administration that would lift up their needs, whole person health. And so, because we believe that this vision was conceived for and by community, we hold ourselves as stewards of the people's vision. We think about the impact that this will make for the individual person, who for the first time ever will have a system with a shared vision, with an end to fragmentation and uncoordinated funding. For the first time, we'll have a system that has moved out of duplication of process and inefficiencies to streamlining of networks and standards and payment models. For the first time, we will have a system where there is not unclear accountability to one where standards are clear and public and where you can hold us accountable. For the individual person in Colorado who needs behavioral health care, and I know for each of us in this room, perhaps we can all say that we've known, loved, or tragically lost someone who needed a BHA. We understand that as stewards of the people's vision, that there are some who have not only been underserved by the behavioral health system, but they have been harmed because of their intersecting identities. And so our commitment to equity and inclusion is quite simple. We believe in and advocate for every person in Colorado, irrespective of their history, identity, or disability, to have access to a comprehensive, effective, and equitable continuum of care across their lifespan. We advocate for preventive supports, not just acute intervention, whether they are the recipients of care or a caregiver. We advocate for clear guidance and care navigation, how to access care when and how they need it. We advocate for trauma-informed care, culturally and linguistically appropriate care. It's got to be affordable, and finally, interactions with the behavioral health workforce should not be traumatic. We are building a learning academy where we are going to engage all providers in the state in building capacity for culturally responsive treatment and care. This is ultimately the end of the story that we hope for. We hope that we will co-create a system that's accessible, meaningful, and trusted. At the top of the screen, you will see that our first work is to focus on people and population standards, to build a comprehensive continuum of care. We've got to associate that with an accountability framework that's, again, not just built on monitoring and audits, but a real strategy of engaging providers in what works, what doesn't work, what's data-driven, and what's evidence-based. As we support our providers with technical assistance and help them retain a quality workforce, we believe that we should also be bringing best practice models into the state, and we are working even now to enter the state demonstration for the Certified Community Behavioral Health Clinic demonstration. As we think about performance, it comes down to quality and payment. And colleagues in the room have heard me talk a lot about the values equation. Our staff hate to hear me say that. I say it in most of our meetings, the value equation. Quality as a function of service type divided by cost. How do we think about bringing and incentivizing high quality care that is not necessarily the most institutionalized or high cost care? How do we think about supporting people in their homes? How do we think about supporting people before they are at risk of justice involvement or other poor outcomes? And so as I close this story, it's really about leaning into the power of co-creation. It's about believing that each person in the state is the behavioral health system. I don't own it. The governor doesn't own the system. We are all the system. And so as part of that, we have launched the new Behavioral Health Administration Advisory Council. Again, this council is driven by lived expertise. It drives our accountability and public transparency. And I show this quote at almost every keynote because it's so moving to me. and it speaks to the generational impact of what we're doing. Raquel Garcia is a woman who is in recovery. She's the co-chair of our Lived Experience Council, and this is how she articulates the generational impact of the work we're doing. She said, "This is so surreal. Never did I think that getting sober 12 years ago would bring me to this moment in time. As a sober and healed Black woman, I am making history. This appointment is for my ancestors who were enslaved and for my father, who was segregated when he was 18. He was never given the chance to heal his soul. This is for them." And I believe that this is the difference we're making. This is what authentic partnership looks like. It is literally breaking generational strongholds. It is literally giving the people of Colorado, whether they be tribal identity, Black, Indigenous, etc., people who have had disabilities, complex needs, intellectual disability, autism spectrum disorder, they have a seat at the table. This has never been done before. As we think about authentic partnership, we recognize that our role is to act responsibly and as stewards, to act in the best interest of everyone in Colorado. We recognize that we must act with authenticity to acknowledge when harm has been done. The BHA will make mistakes. We understand that, but we are committed to truth. We're committed to acknowledging when perhaps our model has not worked as well as we thought, and working again and leaning into co-creation to even correct those missteps. We believe in upholding our shared values and ideals. We believe in being a source of change and not conflict. I was just sharing with someone here in the audience that we can disagree on the what, but let's get aligned on the how, the values. We also believe in transparency and embracing openness. The urgency of this story is that we cannot wait. Colorado needs us right now. We have a third of high school students right now in our state who endorse in any given week feeling sad or hopeless. We have an increase in drug overdose deaths, as most states have encountered during the COVID-19 pandemic. Colorado needs us right now. Depression, anxiety, they're all on the rise. And as we emerge out of COVID-19, the real question is, now are we going to heal our mind, body, and spirit? And so with the people of Colorado, we're beginning to create a new story. The first product that we co-created with our user design group is OwnPath. If you haven't been on the site, check it out, ownpath.co. This is a new place for people in our state to receive access to care. They can search on this website for providers, and we know this does not fix all of the access gaps, but at least provides information in a manner that does not make one feel ashamed. And so at the end of the day, it comes down to this. We need a system that works for the people of Colorado, for our family members, for our loved ones. We need a system where no person is left behind, one that puts everyone first. We need a unified vision and strategy. We are committed to aligning with the federal mental health strategy and very excited to hear about the emphasis on that at the federal level. We need a comprehensive data approach. We're building an interagency data governance board to support that work. And I think you heard some about that this morning from Director Bim Steffer of HCPF. And finally, we need to build a system that is truly coordinated and is built for generational impact. And so in closing, we exist to ensure that every person has equitable opportunities to achieve mental health wellness. And so we hold ourselves accountable for creating meaningful outcomes across the state, for you, for our loved ones, and for generations to come. We invite you to be a part of this story, which is still being written. Thank you very much for listening. Yeah.
That was incredibly powerful. Thank you for sharing that. Again, I need it to sink in with folks that no other states have an administration that doesn't either pay for a service or provide a service in behavioral health, right? It's not that's something that's brand new and nobody else does it, right? So even that by itself, there's an entire story there that could be told. We do have a little time for questions if there are those in the audience. I do want to kind of kick one off that I'd just been thinking about, and as I heard Dr. Medlock's comments, this is a very innovative approach. It's very inward-looking to state government and how services are rendered and things like that. But I would ask you, what's the PSA or the call to action for a room of engaged stakeholders? What's their call to action, right? Where do they contribute? Where do they help? Where's the push and pull that's helpful to BHA and to the things going forward?
Well, I think that, again, this is a really powerful moment for every person to be a part of this new vision. And I have met with leaders in every sector at this point. We've started something called the Commissioner State Tour. And so if you'd like to talk with us, meet with us, please just go on our website under About Us Statewide Tour and let us know. We'll come by and talk with you. But I think every person in the state can be part of this vision. We're looking for new ways to fund services. We're looking for new ways to braid funding streams. We're looking for new thought partners. So please join us in this work.
Questions? Here, yeah, into the mic.
Sorry.
There you go.
How do consumers get a seat at the table?
Absolutely, thank you for that. So the advisory council, out of the 20 members on that seat, which is a very powerful board, 16 out of 20 have actually had some experience in the behavioral health system or supported a family member in the system. In addition, all of the meetings are public, posted on our website. We have public testimony every month. They just had their October meeting, but certainly join us in December, and we hear testimony from any person that shows up, and the council responds to that testimony in writing on our website.
Others?
Thanks. So I'm just curious, Medicaid is the largest single funder of behavioral health services in the country and in each state. I'm just wondering if you could say a little bit more about your coordination with Medicaid as a financing system, and also maybe as part of that about the integration of physical health and behavioral health.
Absolutely. Well, the partnership with Medicaid is vital. So, our structure is, first of all, we meet biweekly to talk strategy and how do we align, for instance, on state demonstration grants, other opportunities at the federal level. Right now, we're also collaborating to think about how can we possibly apply for a waiver to address social determinants of health. So absolutely, that partnership is vital given they're the largest payer. In terms of integrated care, it's vitally important. This past legislative session, there were a couple bills passed that provide some funding for HCPF to address integrated care. I believe they have a $32 million pot of money to address that particular issue. We are looking at also in our rule rewrite process addressing integrated care, especially primary care-based approaches as part of the early intervention stage of our continuum, and then creating levers for individuals with more serious mental health needs to then have a path for navigation into higher levels of care. But the long and short of it is, integrated care is vitally important. And, HCPF is looking at the payment model for that, and we're looking at how do we write the rules and standards to support that comprehensive continuum.
Last one, you make it a good one. This is it. You're between fancy snacks and drinks.
Oh my goodness.
No pressure.
No pressure.
I'm Linda Osterland. I'm the Dean of the College of Health Professions at Regis University. My question for you is related to mid-level providers, so licensed professional counselors, marriage and family therapists, social workers. Do you see leveraging them as part of the behavioral health workforce and advocating for more access and reimbursement for Medicaid for them as well?
Absolutely. And if you go to our website under publications, And our workforce strategic plan talks about some of the incentive and retention grant programs that we're hoping to roll out later this year. We've heard from a lot of providers that mid-levels are leaving behavioral health for other opportunities, especially in the context of the pandemic. So check that out, and we'll have some more updates on those grant programs later this year.
Very good. You lived up to the last question. That was fantastic. Join me in thanking Dr. Medlock for her time today and her comments.